We are live.
The Senate Appropriations Committee, Thursday, March 19th. We're going all bills today. Bills all day, no budget testimony. So we have to get all the bills out that we have by tomorrow. So those, we have another 2 bills that are coming, 3 bills today. So then tomorrow we'll get those out, and then hopefully we get all these out today. So we're going to start with S-278, although I do not see Senator Ron Hinsdale. So I wonder where she is. You wanted to talk to us about? You do, you can hear? Yeah, she has a distinct voice and laugh. We'll walk in. Will you move a chair up to the witness? And she'll know we're ready. Thank you for your help. Perfect timing. We are live and ready to hear your presentation of the bill. We sometimes print those out, but we have not printed that one out at this moment.
Okay, I have nothing.
You can just give us like an overall high level.
Yes.
What the bill does.
Yes.
And then council can lead us through details.
Great. So, pardons to Senator Lyons, who heard this in her committee, a little bit more public health focused. So S-278 is, I would say, the first time the Senate Economic Development Committee has had the chance to say, this is a legal substance. We had the debate in the past about whether or not to tax and regulate it and create, you know, a market that operates within the law around cannabis. And we had received some bills from the House in the past around, you know, trying to figure out some of those challenging details of how this all unfolds. But we had not been able to say, how do we create a coherent market that pulls people out of the illicit market and is somewhat harmonized with other states from a commercial perspective? This all becomes, I think, far more important given the overtures from the federal government that they may deschedule or change their relationship, their federal relationship with cannabis. I did say in health and welfare, that's something I think we're going to have to consider sooner than later, is the already regulated industries that may want to get into THC beverages. You know, that's like the consumption of those otherwise might take place at the same place alcohol is consumed, et cetera. So, you know, we have more regulation, I think, to make should things unfold. But I have tried to follow the money, and there are cannabis companies like Curaleaf or ones out of Ohio that have a lot of ties right now to the federal government. And I don't think, let's just say if changes happen at the federal level, they would not benefit small craft growers in Vermont. So the thrust of our bill is really in many ways to do what we've done for beer, wine, and spirits. And particularly there's a lot of parallel to spirits where we turn the dial very slowly and, you know, allow consumption in more and more places over a very long period of time. And we now have an incredibly robust and nationally and internationally known spirits industry. Our Vermont brand in cannabis is high quality. It's, you know, a respected brand, and it signifies to people local farms and rural vitality. So the bill, much of the bill, I would say almost all of the bill is the CCB. Was written in collaboration with the Cannabis Control Board. And they have study after study of ways to pull people out of the illicit market. The illicit market is often where children are harmed, right? Or really anybody, where you have products that aren't labeled well, people DIYing their doses, or, you know, So it should be all of our goal to pull people into a regulated market that has proper labeling, is taxed so that we get the money back from that to do good things to reinvest in our communities and our kids' mental health. But that otherwise we're not pushing people either to the illicit market or out of state. So what you see remaining in the bill are either pilots or increased purchase access that really just harmonizes us with largely Massachusetts, New York, Maine, even Connecticut to some extent. Then most of these states are looking once again at their cannabis market in light of what's coming from the federal government. And there is active consideration in New Hampshire, and they would be likely to put their cannabis products in their liquor outlets on the highways, leading to and from our state. So like many things in economic development, we are not having the debate about whether or not this is right or wrong, but how people have the safest and most regulated experience and how it benefits our communities. We just, we have a lot of, I don't know why I'm pointing at Richie, but he's the second lead sponsor of the bill. We have a lot of, rural communities that are thriving because of spirits, beer, and now cannabis, legal cannabis. We can feel however we want about that, but they are bringing far more revenue into the state than we had forecast when we began this market, and we want that revenue back from other states and out of the illicit market.
Okay. Do you want to say anything about the two?
With the money, yeah.
There's money on one in particular, there's $1 million from the general fund of the Cannabis Business Development Fund.
Yeah.
And 1.68 to the land access option.
Right. Well, I could also wax poetic a little bit about, the feelings that the Economic Development Committee has largely from a policy perspective about how the Cannabis Control Board, as of, I believe, last year's budget, falls under the governor's purview, and they don't get to take in the money that they believe is needed to do the statutory work that we've directed them to do, and then give the rest to the general fund. I understand, the pressures on our budget, and I wonder if our committees can work collaboratively in the future on some way for them to remit quarterly, but still keep the resources they need. We are asking them to do more to help if we do end up passing pilots in delivery and on-site consumption. That is going to add to their charge, but it also, is something that adds to how our local craft market can reach people, right? So we think it's a important economic good to help our local industry do, pilot weddings that feature cannabis instead of alcohol, to have small festivals, farmers markets. I don't want to get us into territory that we literally change every year a little bit, even for alcohol. But if we pilot some of these things, they have more work to do, and they're consistently doing it with fewer resources once they are a part of the governor's budget. So they, as you know, cannabis brings in more money than they're asking to spend in their budget. And they used to be able to take what they felt they needed in a dynamic changing market.
So you're not changing their budget.
Well, I just wanted to have the bigger conversation that was a big change that we're learning about as a policy committee, that every time we talked about a policy change, it certainly came up that they can't guarantee a safer or better experience with the staffing level that they have. Specific to the bill, there's the $1 million for the Cannabis Business Fund. The original Cannabis Business Fund, as it was envisioned, is not necessarily the same, doesn't necessarily have the same need now that the market, has some saturation. We really are thinking about it as, there are a lot, like a small craft producer or grower has a lot of legal challenges they need to meet, needs a lot of technical assistance. And we feel that that fund needs more money, but we also don't need to put certain parameters around who gets access to that money.
Who runs the fund? Where's the money going?
It goes into DHCD, and is it DHCD or just ACCD? Somewhere else than DHCD. I think it's, so that person spoke to us and said, we don't have a great need to give out $5,000 grants, but we would love to be a pass-through, for example, entities like the Vermont Law School Business Clinic, because they can't serve cannabis businesses right now with the federal requirements they have on their funds. So it came up that there are a lot of entities that support businesses that currently can't help cannabis businesses who probably need a lot of help, especially if federal regulations change or we create some kind of cooperative relationship with states around us. A lot of legal and technical support is needed in the industry. Right. That's what that would be directed toward.
And the money.
Tucker looks pained, so I don't know if I'm sounding really confident but wrong, but.
No, that's good. The LAOB, it is the 1.6 million in this budget on top of their
yes.
governor's budget.
Yes. So some of us have been here a long time. Actually, a lot of people in this room have been here a long time. And, you know, as I recall, since before we legalized cannabis and in every year since, we've talked about what it means to repair the harm done to people who were caught up in the war on drugs and the decimation of communities and households and families over the criminalization of cannabis. I meant to bring this to health and welfare, but Pew Research just released a study that of a lot of the taboo topics in the world and things people think are morally unacceptable, after the very high number of people in the world who think that cheating on your spouse is the most morally reprehensible thing you can do, at 70-something%, 52% of the world still thinks cannabis is the next most morally unacceptable thing, well above other things that have lost their taboo nature because they've been out in the public and destigmatized.
It was launching an illegal war in another country, one of the items.
You know, unfortunately it was not. It was things like homosexuality and alcohol and contraceptives and stuff. But cannabis remains a very stigmatized product and topic in the world. And the reality is, many people harmed by the war on drugs do not want to go into cannabis production. You know, they don't want their reparatory offering to be you're first in line to get a business license for producing cannabis. The Land Access and Opportunity Board, I think you all can judge for yourselves, but you know, our committee feels they've done a really incredible job with their charge, which was in this realm to reinvest dollars that had been divested or taken away from communities that have not been able to build generational wealth because they've not had land access or access to certain types of opportunity. So they gave a great presentation to us on what they would do with those funds. And it sort of met our intent always that when we saw cannabis raise a significant amount of revenue, we would be reinvesting some of that in the communities that were most harmed.
Okay. Any questions for Senator Ron? Yes, Senator.
I'm at the fiscal note. I don't know if this is the time to ask the questions or whatever else.
Yeah.
On your bill summary, you listed several sections in here. Did the Cannabis Control Board have any problems with any one of these sections? And if so, which one and why? Or
Tucker, we took out the sections that were most problematic to others. The Cannabis Control Board did not want to change our advertising policies right now. You know, we took a good hard look at how cannabis is being advertised nationally or from our, you know, a neighboring state to our state, et cetera. They, since some recent legal activity, have made some changes to how much they expedite those advertising, the preview they get of people's advertising. So we felt satisfied enough with that. They did not want us to change the advertising policies at this point. and we did not change any of the caps on product concentrates. So actual cannabis flower or solid concentrate or liquid concentrate. We are on the more constrained side of limiting the THC concentrate that a product can have, but we're not complete outliers. So we took that out, and that was most of what made up public health concerns. But almost everything else in there, and even some of those things, even including, I think, the solid concentrate THC cap, which Senator Sears had a lot to say about in past years. That is, they have studies that show where we're losing people to the illicit market. And we should constantly be refreshing our understanding of those studies. Where we lose people, that's where they are more likely to have some kind of psychosis or some kind of effect on their health that requires hospitalization. So they do try and tell us both, here is the ongoing public health research, but here is also the behavioral research we do as to where people buy their products and what they buy.
So what you're saying is all these sections they agree with presently? Just a yes or a no. It's that simple.
Member Anderson, Legislative Council, I do not want to offer testimony on behalf of the CCB, but you can refer to the testimony that they've given in Senate Economic Development and Senate Health and Welfare about their support for and concerns about the bill. And just from the chair's testimony this morning, it seems like their concerns have been ameliorated.
Because I mean, going from 1 ounce to 2 ounces, I mean, that's backpack material. I mean, you're just getting, I don't understand the reasoning for that increase in the purchase transaction from 1 ounce to 2 ounces. And I can see the Cannabis Business Development Fund, but I don't understand where the LAOB comes into this play here when we're talking about cannabis and marketing and.
Okay, so let's start with the increase in purchase limit. That in many ways does feel like a very commercial consideration, right? How much can someone purchase from one store at one time? There is really nothing stopping someone from going into multiple stores and purchasing different amounts. And there are people who cross state lines specifically because they just want to have one of those interactions, maybe. Like we talked about how stigmatized it is. Not everybody feels like walking into their local cannabis shop. So if they do, they're not, purchasing more so that they can consume more immediately. They're purchasing more so that they can come back at a much later time to meet their consumption needs. We would call it maybe like the Costco, effect. Like
Buy 3 cans of beans when you
exactly, yeah. Like if you're ever behind someone at Costco who's from a rural part of the state, chances are they have huge sacks of, pancake mix and bacon, and they are not coming back for 6 months. So, we have rural parts of the state that have absolutely no retailers. So Maine similarly has this purchase limit. You see them increase their caps more because rural states, it's just, we're trying to meet consumer choice and consumer demand for how often people feel like going to frequent a cannabis retailer.
And the LAOB?
So the LAOB, again, the CCB has specifically named them as an ongoing partner in their work to improve economic opportunity and reduce substance misuse or reduce, illicit activity or mental health impacts associated with the social impacts of cannabis. Like all substances, they can be exacerbated. Your experience can be exacerbated by poverty, or by continued economic distress. And so it was just simply always part of our consideration that we would think about those most impacted by the previous criminal nature of cannabis, and that we would try to help those who have been justice impacted, who are extremely rural and isolated, who are in poverty, or who come from communities that were historically targeted in the criminalization of cannabis. So that's always been part of our conversation. We always came to the very edge of directing a percentage of cannabis revenue to that cause, and then said, we don't know how much it's going to be and how stable it's going to be. It's an incredibly successful market at this point. There's a lot of revenue coming in. And the CCB for years has said to fulfill their charge to try and repair social harm, they see the LAOB as one of their best partners to do that. LAOB was talking to us about their resilience hubs and other ways they use the funds that in a lot of ways speaks to like really what we envisioned for repairing harm from cannabis, rebuilding community, reconnecting people with community and resources, and having vital downtowns, vital organizations that come from the community. They've simply had a lot of success. I mean,
they testified here on their budget about the resiliency grants and other.
I know there's been conversation in here about how do we keep communities whole and intact before some kind of crisis event might occur, like frankly what we saw in South Burlington, I would call a crisis event. One of those events is extremely expensive. I mean, one of those events is probably the cost of, the entire amount that the LAOB is asking for. They're asking for people to have strong relationships and resilient community before there's a crisis that ends up being very expensive because people don't have trust and they don't have relationships.
Okay, thank you. Any other questions? Yes,
you touched briefly on beverages.
Yeah.
I don't see anything in here about beverages, but they are allowed now, currently.
There are up to a certain 10 milligrams of THC beverages.
Okay. So I don't know if that's per 12-ounce can.
If I may.
Please identify yourself.
Dave Silverman. I own and operate Florida Cannabis in Middlebury. Yes, 12-ounce cans, up to 10 milligrams per can. That is all we're allowed to sell.
10 milligrams per can. So the reason I ask is that there's a fairly large grower in the islands who, I guess the Cannabis Control Board put out a document that people thought originally was going to be cast in stone, and it was guidance, it turns out, right?
Yes, sir.
So are they still allowed to sell a case at a time to somebody coming over from New York to purchase that?
I believe you're referring to their draft guidance that they put out about purchase limits that would have limited up to 10 cans per transaction. That's been rescinded. And so, yes, a person could get a case, even 2 cases of cans. There's very small amounts. 10 milligrams is in almost all states considered the standard. Certainly.
All right, thanks.
And I kind of brought that up without closing the loop, but whether or not it impacts the appropriations of the state, we have a section on having far more municipal guidance and control, because we felt like that was a real missing link. When you allow for cannabis retail in your community, you then don't have significant control over siting or time, place, and manner. So we try to include that in the bill. And I think there's some future hope that, like spirits, we can take less of a cut at the state level and give a little bit more of a cut to the community that's doing a lot of the regulating. And I close that loop with on-site consumption, because eventually, if we see on-site consumption allowed places that it functions like a bar. We right now don't have anywhere that you can consume cannabis on site in a licensed third space. So municipalities need to be able to manage that.
Okay, we got to move along.
Yeah.
So thank you.
Yeah.
And we'll ask Lush Council to come up to talk.
Great. I'm gonna go.
Yeah. Okay. Thank you.
Yeah.
Councilor Anderson, unless if there's anything else you want to say about the bill, you can, but otherwise, I wonder if you would walk us through the amendment.
I can absolutely do that, and good afternoon. For the record, Tucker Anderson, Legislative Counsel. What I'll be walking through is draft 1.1 of a committee amendment to the bill. It focuses very specifically on the appropriations. You heard about them. The appropriations in the committee report from Senate Economic Development included $1 million to the Cannabis Business Development Fund, which, to confirm from the earlier testimony, is a fund administered by ACCD. And some of the primary functions of that fund are to provide low interest loans to certain qualifying businesses, as well as grants. And under a different section of the bill, eligible participants for the low interest loans is expanded to include different types of licensees. Along with that, in the appropriations, you had the $1 million going to the CBDF and the separate appropriation for the LAOB. The amendment is fairly straightforward. There are two instances. The first is something that I caught when I reviewed the report from Senate Economic Development. I had failed to update an internal cross-reference to two sections in the bill. So there's a technical correction in the first instance of amendment, updating those section numbers. The second is completely removing the appropriations from the report. And that is all.
And there's one tax credit in here, but the fiscal note said it was de minimis, so we're not gonna deal with that. It allows them to deduct their business expenses from state income.
For purposes of calculating the property tax credit.
Only for the purpose of the property tax credit. Okay. Any questions about the amendment or the bill? Legislative Counsel? Okay, I will entertain a motion to
I'll move the amendment
move the amendment and the bill favorably.
and the bill favorably.
Okay. Any questions of the maker of the amendment or the motion? Yes. Senator Norris.
One quick one, you had brought up the governor's, what was his recommendation for the LAOB?
This amount 1.68, so they're doubling.
They're doubling it.
Yeah. So this amendment strikes that section.
And it also strikes, the delivery permit section.
No, it does not.
No, the Cannabis Business Development Fund.
The delivery and the house and the event fees would still be collected,
Okay,
but the $1 million to the business development would be taken.
good.
And our committee took testimony on this with Pepper and Tucker, and most of the things that I was concerned about that were in the bill initially, that we were going to have to deal with in our committee, were taken out, so.
Did you guys actually take possession of the bill?
No. We would
You
have.
didn't have a vote.
Yeah, we might have if there had been, additional
Right.
stuff.
So like when the THC.
Yeah, the committee's fine.
So this amendment deletes section 28?
Yes.
Okay.
It's a tax.
Becomes hard to take it when it passes a crossover.
Yeah. Okay. Any other questions? Okay.
Okay, S 278, Senator Baruth, Senator Brennan. Yes. Senator Lyons.
Yes.
Senator Norris,
Yes.
Senator Watson,
Yes.
Senator Westman.
Yep.
Senator Persley.
Yeah.
Okay.
Does anybody want to report it? Anybody like to sponsor the bill or anything? I will do it. I'm willing to do it unless somebody wants to do it.
You want to do it?
I know, I'm willing to do it. I don't know if want is the right word, but I will do it.
You want to fight him for it, or?
No, I got enough.
Okay,
I've got enough. Bills.
thank you.
Thank you.
Hopefully Jen Carby's.
Should be across the way. I actually have to kind of early.
Okay, we will mute until we
Well, she's also 142.
Yeah, so
No,
you can start us off.
I will try.
Okay, we're off.
I don't have it in front of me.
We're
Bill,
back,
I'll-
we're
let me
off
find it.
mute. We're gonna take up.
We don't have it.
142.
You don't have it, no?
It's in appropriations. I'll just pull it up so it's fresh in my head.
So we're not gonna vote on it today. Centerlines won't be here tomorrow.
And I'm happy to report whatever you need me to do with it.
Well, if you just tell us the basics of
So
what
the
it is.
basically, the bill is, it's the development of a pathway for licensure for internationally trained physicians and medical students. So it's a way that they can demonstrate their credentials and validate their profession in Vermont, and then be granted a license based first on working with others in the healthcare environment. Oh, and then secondly, then gaining a transitional license until they become fully licensed in Vermont. So that's basically what it is. But within that, this bill has been in the works for a couple of sessions. And initially, the Board of Medical Practice within the Department of Health was resistant to working on it. So the group went back and did additional work, came back, and the board still didn't respond didn't provide testimony to us that would improve the bill. Finally, very close to the time where we were passing the bill, the Department of Health came in with the commissioner and is looking for a pathway to work on this issue. And honestly, the Board of Medical Practice, Department of Health, in order to establish a program like this, will have to do a lot of work. There's a lot going on in other states. It might cost some dollars to do the work. So we put in both the pathway that was developed by the working group in Southern Vermont, and also a report from the Department of Health about what they would recommend. There is a little hitch there that the report will come in, and regardless of the report will come in, and I forget the timing on it, Jen's gonna help me with that. If there isn't any action in the legislature by a date certain, I think could be July 27 or 28, I forget where we put it. The program that we have.
July 1st of 2028.
Yeah, 28, then the program will begin regardless of what the Department of Health says. So it probably makes sense to have the report come in first and then influence the final product. Because there'll be a lot of information about administrative costs, administrative timing, and exactly how to measure the proficiency of the folks who are applying.
Who would have to administer, so it came here because people thought there would be a cost to implement it?
There is a report in here. I don't know what the money is in here, to be honest.
Senator Bloomer said something about, did OPR testify on this bill? That it's not an OPR thing.
It's a Board of Medical Practice, yeah, but.
So maybe the Board of Medical Practice would have
Well,
to.
yeah, they testified that it will cost them some money to do the work.
Okay, they didn't ask for money.
No. To do the work once the program starts going
Yeah, he
forward.
told me today that it was coming here, but I don't remember him actually saying why. I thought,
I don't know
oh
what.
no, he was talking about the ophthalmologist bill.
Oh.
The OPR
that
might
one.
have some expenses on that, but
Yeah,
this one, okay. All right, but we don't have possession of this bill, so we can't vote it
No,
out.
it has not been taken up across the, Jen Carvey Legislative Council has not been taken up across the hall yet. I believe that is happening today.
Okay, so we will take it up and vote it out tomorrow. It looks like we don't need an amendment, and we'll do that tomorrow.
If you
Do you
wanted
have
to
a
change the
I
date.
do have one
would
question.
be-
don't know.
I think it's good. I mean, you get a lot of talented individuals who want to come to do this. I
Exactly.
think I found my answer to one of them. So does this mean they're gonna act like as an intern under the supervision of another provider, or because it said they have to carry their own provisional malpractice insurance? And how do
They
they?
don't carry it,
No,
the facility does,
the supervising physician.
the supervising facility.
So do they operate as an intern, Jen, or how does that work?
I don't know how much of this you want me to go through. I have to say, I also
go
have a
ahead.
We'll do
bill
it
on
tomorrow if you want.
floor that is now having an amendment on it, so I'm
Okay,
trying to figure
that's
out how to be
Two places at once.
two places.
Yeah, we can do it tomorrow.
Yep.
And we can learn more about the details, but it seems like they'll be like an employee, they'll be on insurance.
Right, they would be, right, they'd be.
Where they're working. They couldn't open a private
supervised,
practice.
right, they can't practice on their own, they have to work as, I think the analogy to, I don't know, to an intern, I'm not sure if that's accurate or inaccurate, because medical interns are something else, but this is a sort of supervised and evaluated practice
Collaborating physician.
for 2 years. Well, it's not called,
Yeah, it's not called that.
that's a different part of healthcare also.
Okay, so we'll vote on that tomorrow. So.
Yeah. Good.
This is probably in your committee too, but Councilor Carvey, do you want to walk us through 197? Or is there a clear financial?
No, I don't believe there is.
I don't think there's any money in
I
there.
don't think there's any money in it.
197.
One,
Yeah.
We have it.
This was another one where we weren't too sure why we had it.
yes, S 197. Let's see, John, where?
Is there a potential impact on our Medicaid or something?
I mean, there is the potential that as things develop down the road, there could be implications for the Medicaid contribution to the blueprint payments, but
Right.
none of that happens yet.
It could happen in the future.
Yep.
That's probably why. I think whenever they see anything, whenever they just see the word Medicaid.
Well, the underlying bill talked about a fund, a primary care
The
fund.
bill was introduced.
Yeah, the bill is
Yeah,
introduced.
so they also.
Yes, although it was just gonna aggregate money.
Yeah,
It wasn't
I don't understand.
appropriating money. All right, I'm joining your Zoom.
Talks about payment methodologies. Spending charge. There's no money.
Was this a committee bill or?
No, it was introduced 197 and then we amended it going through this.
All right. Put the, perfect, thank you. Language up. Yes, okay. Great. This is S 197, an act relating to establishing a primary care payment reform program, although that name changes at the end. It expresses legislative intent to invest in, it should say primary care, just as primary, through streamlined primary care payments, building on the blueprint for health, and will promote the public good by increasing access to primary care to improve health and reduce health system costs. It makes some changes in section 2 to the blueprint for health statute, or chapter, namely around requiring health insurers, which is private insurers, to submit comprehensive information necessary for the blueprint director to do a comprehensive fiscal analysis of the total cost of care in Vermont and to implement payment models addressing healthcare capacity, volume, quality, and clinical outcomes. It requires the blueprint payment reform methodologies to, this is current law, include per person per month payments. This would be not just to medical homes, but to participating practices, including medical homes and primary care providers. So I suppose there's the potential that there could be additional per member per month payments to non-medical home primary care providers. By each health insurer and Medicaid for attributed patients and for contributions to the shared costs of operating blueprint initiatives, again, maybe broader than the existing community health teams. And there's some fairly technical changes in here, but does specify that the amounts from insurers shall be in amounts amounts at least equal to Medicaid payments beginning in 2027. Medicaid is currently the largest contributor to the blueprint. And this is language requiring the director of the blueprint to strive to achieve or maintain parity across payers and payment methodologies when formulating recommendations to the Secretary of Human Services. The rest of this is really technical, reflecting that the blueprint is now at AHS, not just in the Department of Vermont Health Access. There's a new provision requiring the Agency of Human Services to establish a target for the amount of per person per month spending on Vermont residents that should be for primary care services, and come up with a schedule that increases that target over time. It allows the targets to be adjusted to reflect payer-specific differences, and directs the increased spending to the per person per month payments established in the blueprint section. Section 3, it has the director of the blueprint reporting by January 1st to the House and Senate Health Committees, the charges to payment amounts or payment reform methodologies that would be necessary to transition the blueprint's per person per month payments to primary care practices to include payment for the routine primary care needs of attributed patients covered by participating health plans. So this is the idea of kind of using our existing blueprint structure to have a more global payment for routine primary care needs instead of fee for service. The report would define which services would be considered routine primary care, address differences in methodology for different practice types, make recommendations on risk adjustment and attribution methodologies, describe ways in which the methodology will balance capacity, volume, quality, and outcomes, include mechanisms to ensure that plans make accurate and appropriate payments to practices in a timely manner, and make recommendations on participation or quality measurement requirements, or both. I guess there's more. Analysis of cost sharing amounts, an analysis of ways to incorporate primary care spending allocation targets into the methodology, and provide an operational plan and any additional legislation that would be needed to start this not later than 1 year after January 1st, 2028. Section 4 is a report from the Agency of Human Services with the baseline spending per person per month spending on primary care services for Vermonters overall and by the various payers, including Medicaid. Requires the agency to use a particular definition of primary care providers and services, either from the federal AHEAD model or what's used by a particular organization. Section 5 is a report on the primary care spending targets, requiring honor before January 1st, 2028. The Agency of Human Services reports to the health committees the per person per month primary care spending targets that they developed, and what we looked at in section 2, and a schedule for increasing that target over time, any recommendations for payer specific adjustments, and any additional legislation needed. Section 6 requires the Green Mountain Care Board to update a couple of reports by January 1st, 2027. One is an updated version of its 2017 clinician landscape study, looking at the current climate among practicing clinicians in Vermont. And the other is an updated version of some of their previous work around site neutral reimbursements, citing the acts that address those. Section 7 is a report from the Agency of Human Services by January 15th of 2027, in consultation with others, and this highlighting came out for the version that's in the calendar. Report to the committees with recommendations on ways to accelerate appropriate transition of patients from hospital care to care in a community setting, including trying to expand the ways in which primary care services are delivered in the community rather than in an inpatient hospital setting after surgery or other acute care. It would be as or more effective and less costly to deliver in the community. Section 8 is a report directing the Office of the State Treasurer and the Agency of Human Services to collaborate with other northeastern states to explore the possibility of a regional universal primary care program that would be available to residents of all the member states, and report by January 15th of 2027 on the interest from other northeastern states, legal and regulatory obstacles, and recommendations for next steps. Section 9 would remove the July 21st, 2027 sunset on a primary care medical student scholarship program that is in statute. There's language in that in that statute itself that allows funds to be carried over. It's my understanding there's about $475,000 in it already that could be carried over and spent, but would not be fully spent by July 1st, 2027. So this would take off, wouldn't add more money at this time, but it would take off the sunset to allow those funds to be fully expended. I think the language, this provision may also be coming, or maybe getting included in the House budget. That's a recommendation.
Okay, well, we can deal with them. Do you have a question, Senator Lyon?
No.
Okay.
Section 10 would amend insurance laws to require health insurers to give patients at least 60 days advance notice before they remove a prescription drug from the formulary, and they would notify all the patients who filled a prescription for that drug within the previous 12 months, so that they and let them know when the coverage will end, so people are not surprised. The act would take effect on passage, and the title would change to an act relating to payment reform for primary care.
A lot of money in there.
Okay, so we don't know, well, probably Medicaid or the future spending of the fund, why it's here, but I don't see a need for a amendment. Does anybody have any questions?
We're gonna vote on this?
Yeah.
What are we voting on?
List.
To vote it out of committee? Have we, that is not affecting the budget of the state, or the expenditures of the state? Because it might have a future impact on Medicaid, match.
Not match, just
I mean,
Medicaid spending.
And this one we do have possession of.
We do have possession. So, if there's no questions, I'll entertain a motion to move in favor of it.
So moved.
That also sounded like a reporter of the bill. Volunteer.
So, S-190 too, we didn't need to do that.
Yeah, well, we have that for later. We could do it. We need to, but we can,
Oh, it's there later.
we'll vote on this.
Yeah.
All set?
Yeah.
Okay, S-197, Senator Baruth. Senator Brennan, yes. Senator Lyons.
Yes.
Senator Norris.
Yes, to move it out of committee.
Senator Watson.
Yes.
Senator Westman.
Yeah.
Senator Perchlik.
Yes.
Jenny, your report?
Sure.
Okay. So, Jen, you're not doing anything else for us today, so you can, you're free to go to do the 10 other things
Now I
you're
have
trying
to
to do.
Let's.
We were hoping to have, do the forensic facility. So we will